Um, I think we'll go very, very fast on the diarrhea in the 5 minutes. I just want to give you maybe the treatment, of course, once you identify the pathophysiology, but just to give you a little recipe to think about when you have profuse diarrhea that cannot be controlled by the usual means. Of course, diarrhea is much less common than constipation is. It will be much frequent with HIV/AIDS. It's not unusual that we see that in that population. For various reasons, sometimes it's infection, but sometimes it can be just the gut is not absorbing anything and finally give you that. Again, in the diarrhea, you have to look at the cause. Disease-related, not disease-related, treatment-related, and drug-related. So one of the offensive agents in the drug-related is the antibiotics. I never seen so much C. diff and diarrhea secondary to having been on antibiotics. So therefore, pay attention, because if constipation is something that you don't want, diarrhea neither, because this can be really, really get on your nerve and give you a miserable quality of life. So you have to look into the etiology of your diarrhea: inflammatory, irritable bowel, metabolic, impaction, infection, all of that. Diet, of course, look at what you are eating. And the pathophysiology, you understand that it's altered absorption of fluid, increased secretion of fluid, increased motility, increased osmotic load. So depending of which is the cause, then of course you will have an agent that will go with each of that. If it's increased motility because patient is either nervous or had something that increased motility, well, you want to decrease the motility, isn't it? If it is an infection, well, you want to decrease the infection and find out rapidly to find an antibiotics or something that will decrease that. So general measure, if you have diarrhea, stop laxative. Sometimes we see patients still on laxative and, oh my God, oh, we forgot. Usually the nurse though thinks about that. Adjust the diet. Some diets really are not for certain patients. They just increase that. Hydrate and review the medication list. So specific measure that you can do all of those above here. And I would like to have your attention. So opioid symptoms, but we are not going to use opioid to correct diarrhea. We just want to keep in mind that it may create some constipation, but I don't think that anybody, except tincture of opium, that you may want to use if you are severe diarrhea that really you need to control right away. But this is something that we don't see anymore on the market. I think that, I don't know, you use it a lot. Last year you did? So I think it depends of the pharmacy. I'm not even sure we carry that anymore here, but it's something you can have on the market. So I just want to say one word on the octreotide, because octreotide, especially in advanced cancer, can be used in various ways. As you know, the mechanism of action of octreotide, you will see that in bowel obstruction, but it decreases the gut motility, it decreases also the secretion through the gut, and it decreases also the vascular delivery to the gut. Therefore, if you have a GI bleeding, it can be used. But it can be used also if you have in advanced cancer. Think about a few indications. And one is, of course, bowel obstruction. You are going to get back to that, so I'm not going to think about that. But two types of patients that we experiment in the past, and really it's useful. Think about those patients who have a vaginal, gut vaginal or something, fistula between the gut and something else. And then that you will have, of course, all the time stools that will come out. And this is very annoying. And in most of those patients in advanced cancer, there's no way you can close this fistula because it's cancer. So therefore, you need to have an agent that may want to decrease the output of your gut. And think about the octreotide. Some patients could not live anymore with total discharge that was not really acceptable to them. And a dose of octreotide, something like 103 times a day, was enough to decrease the output and therefore give them a better quality of life. Another type of patient, also think about that. Patients, mainly, I would say, into the HIV/AIDS community, they will tell you, I go 20 times a day. We had patients in the past 20 times a day. Imagine what this represents. And that was not infectious. Of course, we need to make sure that's not an undergoing infection for which they need some antibiotics, antifungal, or an anti-anything. But there was none of that, and this guy was still going, said, do something, I cannot live with this. And octreotide can be also in use for those patients who have too much of the delivery, gut delivery, and for which we can stop. Again, you need a titration. Usually it's 103 times a day up until you can go, max out is usually 1 gram and 500 mics. You rarely have to go that far. Octreotide can be given as a sub-Q injection 2-3 times a day, can be put also in an IV continuously. If patient is already on TPN or something like that, you can put that also into the IV and deliver constantly. So these are really two circumstances you should think about. Your patient will be so happy with you because you stop a diarrhea that's really is cumbersome. So I'm stopping here. Any questions of any sort on a topic that I must say, starting with the day with that is not okay. But anyway, that's, as Terry said, that's part of our body. And as you know, there was a story like that. Which organ of your body is the most important? And everybody will say the brain, isn't it? The brain, because, but some say that it may be the rectum, because if the rectum decide to constrict and not move at all the other organs will say, please do something. You see, so I think we need to be geared for that. It's not something we like to talk about. It's not something as good as pain, you know, something, well, we do something, but there's a lot we can do for those patients who really suffer from those GI problems. So, no questions? I guess it was clear.
Thank you.
Okay, take care.